Hi, welcome back to Girl Talk. We're here with Dr. Amy Sargent from Excellence in Dentistry.
Hi.
Thank you for being here.
Thank you for having me.
So talk to us about healthy mouth equals healthy body. What are the current trends in dentistry?
Okay, well, I think one of the biggest trends currently is you'll see in the news a lot of discussion and research on how the health of the mouth relates to the health of the body.
Sure.
And it's just very prevalent that people are more aware of that, and you're seeing a lot of research about those things.
Sure.
Yeah.
Sure. So what changes have you had to implement in your office to accommodate this trend?
So in our office, we've implemented something called the Healthy Mouth Baseline. And it's a tool that we use as healthcare providers. We use it with our patients. So when a patient comes in for an appointment, we go through this Healthy Mouth Baseline with them. And what we do is we identify areas in their mouth that may be problems, as well as areas that are great and things they're doing right. And the areas that appear to be problems, we discuss with them how they can fix those things, as well as how those, if not fixed, may relate to the health of their body or may cause problems in the health of their body.
Sure, that's definitely important.
Yeah,
Good to know.
absolutely. And I think this is such an interesting topic. We got the opportunity to talk the other day, and it's kind of fascinating to me how holistic the body is and how everything really is connected. And it's a topic that you don't often think about, that dental health, gum health, things like that are so connected to what else is going on in the body. So talk to us about what some of maybe the diseases are that you've seen that are related to these different things in the mouth.
Well, we've seen a lot of research out there to show that heart disease is related, stroke, diabetes, even things like low birth weight infants and premature birth can all be related.
You'd never think, would
Right.
you? Yeah,
Right.
it's surprising.
I know.
So let's talk a little bit about periodontal disease specifically, and is there something related to that more specifically, or all of those things?
Definitely, those things are definitely related to periodontal disease, or can be correlated with periodontal disease, because periodontal disease is a disease in the mouth that is basically inflammation and infection in the mouth and the gums. So inflammation and infection, as you all may know, causes many diseases in the body. So when you have inflammation and infection in your mouth as a chronic disease, which periodontal disease is, then that can basically cause problems throughout the whole body, you know, like an increased incidence for heart disease, increased incidence for stroke, and a worsening blood sugar levels in a person with diabetes.
Wow, surprising.
Yeah, I really try to take care of my smile, but now even more so that it's all connected.
Right.
What can the viewers at home do themselves to prevent periodontal disease?
Well, I think probably the most important thing is to see your dental health professional regularly. A lot of these things don't have symptoms, so a person may not really know if they have periodontal disease unless they really get checked out regularly. So that's a really that's really important. Some people that come in may have never had a diagnosis of periodontal disease, and it's the first time they hear about it. And maybe they haven't been in for many years. So I think it's really important to, you know, get your nerve up and go see that dental health professional if you haven't been for a while. And then the obvious things like brushing and flossing. I mean, those are completely obvious. And then we also want you to eat a healthy diet, because the nutrients in your food help to sustain healthy gums.
Sure, absolutely. What you put in.
Definitely.
Very important.
Very important, yep.
So if gum health is important, what else is needed to be taken into consideration for a healthy mouth?
Well, one thing we look at when a patient would come in is we also look at, you know, their smile and how things look when they smile. And things that patients may not notice, or maybe they do notice, but we want to look at to be sure that they're comfortable smiling and that they feel good about their smile. We also look for broken teeth, chipped teeth, cavities. Those are things we can see when we're doing our healthy mouth baseline. So we want to be sure and identify those areas that are concerning to us, but as well as concerning to patients, and then kind of formulate a plan for how we can make everything healthier.
Well, thank you so much for being here. I learned a lot in just that short segment.
Great. Thank you for having me.
Go check Dr. Amy Sargent out at Excellence in Dentistry. She's got 2 locations on Cottage Grove Road and also on Sherman Avenue in Madison. Stay tuned for more Girl Talk. We'll be back with Apple Wellness to how to supplement your life.